My name is Stephen Hanff. I'm a board-certified orthopedic surgeon, and I practice here in Trinity, Florida. I was actually born in West Pasco here in Newport Richey, and I'm proud to be able to come back and serve those in the community that helped to raise me. I love orthopedics. Orthopedics is really taking care of all musculoskeletal injuries and putting bones and fractures back together, as well as treating ligament and different sporting injuries. And for me, it makes a lot of sense. I was the kid that was always tinkering in the garage growing up. I was trying to build go-karts out of old parts that I could find. I had strewed Legos all over the house that I think drove my mom pretty crazy. But I really loved building things and putting things together. So for me, to be able to take those skills, those interests, and put into my career is very rewarding and satisfying. I met my wife actually here in Newport Richey. We actually met in high school, and we actually both went to the University of Miami, which was a brilliant place to train. We went to college, and we both went to medical school there, and then finished my training in Gainesville. It was 2009 when I came back and started practice, and actually spent the first couple years working side by side with my father. As an orthopedic surgeon with 40 years of experience, was a phenomenal opportunity to really get that next level of education beyond what we learn in the textbooks and what we learn going through school. And having that opportunity with the opportunity of my training really has brought me to the point where I can now bring back to the community and bring things that they brought to me and help to form me as a person. I don't think my hobbies have actually changed. Who I am from being a kid to now, I still like working with my hands. In fact, 2016, I just finished completing a wooden boat build. It took me about 2 years to do. It's one of those crazy ideas I came up with at the time back in 2014. Had a little downtime and found some plans on the internet. But I took it from start to finish. I found the lumber, went through the plans, and it was a great experience. I learned a lot about both woodworking, working with epoxies, bronze fastenings, fiberglassing, painting, and even running the electrical. But for me, it was a great way to incorporate what I do every day, my hobbies. And I could spend a whole day doing surgery. I'd come home, play with the kids. Once they're asleep, I'd go into the garage and spend another hour doing it. So despite needing that time to unwind, it's still part of me and what I do every day. But being able to work with your hands, put together the boat, drill holes, fill them, and have an end product that you can be very proud of. The analogy is very close to what we do in orthopedics. We have our plans. We go in having that plan, our backup plan, our backup to backup plan. And so then when we complete something and we see that end result, the fruits of our labor are readily apparent. When you can do a surgery and someone's up walking within an hour and they actually have less pain an hour after the surgery than they did coming into the surgery, it's quite incredible. When we take care of patients, we are constantly guided by evidence-based medicine principles. So we look to the literature. There's droves of literature. There's thousands of articles published every month, and we use those peer-reviewed journals to find the treatments that we know works. We're not here to waste patients' time with treatments that aren't going to help or have risks or cost too much without proven outcomes. We want to get patients better quickly, speedily, without wasting someone's time or money. And so we use these evidence-based medicine guidelines to take us there. And we've really incorporated these principles into our rapid recovery program. The ability to take a patient, identify certain risks, eliminate or minimize all those risks, and then take patients through a speedy recovery. And this involves a lot of patient education. I'm their biggest advocate. I'm the one pushing for all this to happen and obviously instituting and recommending these treatments. But to go from start to finish and have a quick, speedy recovery while avoiding complications, that's the best thing we can do for our patients, and that's what makes things very rewarding for what we do as surgeons. As I mature in life, I kind of see how the transition from that fearless young athlete may transition into more of a wellness program with working out, and then ultimately some of those injuries that come home to roost for many of our patients really affects quality of life. When we approach patient care, I understand I have to span all those spectrum of injuries, from the young sporting athlete who's very aggressive to maybe somebody who just wants to kneel down with their grandkids or walk for 20 minutes without having pain. And so my practice really has a dichotomy between doing lots of arthroscopy and sports medicine and transitioning into a lot of joint reconstructive procedures, joint replacement and revision reconstruction procedures to keep people active as long as they can in life. And so it's my philosophy to be able to take someone from whatever injury it might be and address them all the way through to that end point, which might even involve joint replacement. Having this comprehensive approach to joint care has given us the opportunity to really expand among the greater community. I regularly see patients in consultation from the surrounding 5 counties. I'll see complex, maybe even a failed reconstruction, where I can take a challenging problem. And these don't always have textbook answers on how to fix them, but to take those problems and make somebody better and get them walking again when maybe they already gave up on that ability is a phenomenal thing to be a part of that healing process. I see myself as the fix-it man. I'm not the healer, but if I can get somebody there and restore that hope again, that's what it's all about. A lot of the problems we see are chronic in nature, or perhaps something has gone wrong and people carry with them pain, loss of function, and slowly give up activities. By the time they reach us, they aren't expecting any magical cure. And we don't promise a magical cure, but certainly the ability to take a problem that's been going on for a long time, make it disappear within an hour. Obviously, going through the recovery process takes some time, but we really can accelerate that. And within 6 weeks after the majority of joint replacement surgeries, we have patients going back to golf, going back to tennis, going back to dancing, things that they hadn't dreamt of doing sometimes for 10, 15, or even 20 years. As part of our joint replacement program and our rapid recovery program specifically, I was the first to bring the direct anterior approach for hip replacement to the community here back in 2013. So it's been a great pleasure being able to do that surgery. You take an operation that's already worked well for actually several decades, and you change the approach. You accelerate the recovery because you don't have to cut through any of the major muscles. The incision's only about 3 to 3.5 inches long. Patients have a small little island dressing, not much different than a really large Band-Aid over the wound. It has changed and transformed what patients regularly were expecting joint replacement to be. Our patients stay overnight in a private room and often go home just the next day. And it's getting to the point that probably won't even be necessary soon. But by and large, it's a great procedure, great operation, and I'm glad to be able to perform it here and be busy doing so. When we created Florida Joint Care Institute, we opened in 2011. Although it was years in the work before then, we wanted to have some guiding principles because our hope is to be here and practice for decades to come. And it was really to provide exceptional orthopedic care to our community in an efficient and compassionate manner. And that has been our guiding principle since the day we opened. It's a privilege to practice here. One of the guiding tenets in medicine is being worthy to serve the suffering. And so we take that responsibility with great pride, but also sincerity. And I thank you, as a patient person in our community, for the opportunity to be able to serve you and take care of the problems that plague so many of us.